It was January 30th, 2007. I had a traumatic brain injury when I crashed my bicycle. At first I couldn't talk hardly at all or communicate with my family.
93, May 93. I was young, started heroin, coma for 3 weeks. Could barely speak.
I was in a high-speed automobile accident. I came through it okay, but there have been some psychological effects that go with traumatic brain injury.
After having struggled to go from just blinking to moving everything, putting down a human body on the paper I just had never had a more wonderful feeling than that. I just wanted to stay in drawing class all night.
Both rehabilitation units at Harborview Hospital and at the university have always had art programs. It's been part of the therapeutic modalities we've used with patients to help them do things like use their hands, develop other interests, also just to have socialization. So there's always been art in our programs, but I think what we were seeing as our patients have been going out into the community and kind of getting their lives back again, we've seen this art blossom from being, pretty small-time projects to becoming pretty impressive ways of expressing creativity for some of our patients, a way of life and a career.
I was on overload from the sensory experience and then discovered that I had this ability now to paint what I felt, and that the goal being that when somebody looks at it, they can feel what I was feeling. And for my treaters across the board, it's been the difference between a little bit of success at a time and really being able to move ahead really quickly, because I can show them that and then they find the words for me, and it's just a process. It's a great process. This one is my favorite one, and I called it synesthesia simply because a lot of people don't know what that is. For me, it's heartbeats because that's the name of the song. When I hear musical notes and tones, I see colors in my what the doctor said, mind's eye, in my mind's eye. So like it's written in the key of D, and D is always this really nice, pleasant, pinkish, and then when the music starts, it gets overshadowed. Like this is a chord, that's why you see so many colors here. Painting helps a lot because I'm trying to, like my neurologist said, I could draw it for you, and she said, so do that. And I did, and then she understood what I was saying. Because you can't, sometimes there's no words.
There are some artists here who can't walk, who really are very restricted in what they can do. To be able to put their physical self into an activity that produces a piece of art is very, very meaningful.
I was at the San Francisco Art Institute for 2 years. I improve every day, yes, because before my injury I could do a lot of stuff myself, but now it's not to look more at it, and it's a bigger process. How do you decide what I want to paint? I think looking around and recognizing the world, finding beauty, try to get beauty out of the world. And I like to do figures too. I'm stuck on that. Well, I like to look at my art, so that's good to know. Also, it inspires me. Lifts my spirits up. It gets me going. Because I want to do more. Just like art. It's good. It's my spot where I can really tap into my being.
One thing you might see, for instance, is someone who is maybe less inhibited about being creative after a brain injury. Now, sometimes that lack of inhibition can be a problem behaviorally, but from an artistic standpoint, sometimes it allows people to express things they would not otherwise have expressed. Also, you do utilize the rest of the pathways in your brain more fully. You do turn on pathways that you weren't using before and kind of exercise those neuronal muscles you weren't exercising before. So I think it's actually true that people may very well be able to accomplish things they wouldn't otherwise.
I hit black ice and ran into an oncoming semi-truck. I had several injuries, and one of which was traumatic brain injury. I get impatient quickly and frustrated easily, and my brain, when my brain gets cluttered, I really get stressed and know what to do. So anyway, that's some of the side effects of TBI that I've been going through. I've been sort of a practicing semi-professional musician out in the Wenatchee area for about 5 or 6 years now, and at the time of the accident, I was starting to compose some songs for my second album. A lot of what came out of my accident wound up being my album called Damage and Remainder. From my chair in the corner. This is definitely from a much more obviously personal angle, and I'm comfortable doing that, and comfortable, but not trying to wear my heart on my sleeve or my what I'm going through all the time, but to express it in a way that's hopefully meaningful for the listener.
It's been interesting to me how often people can develop sides of themselves that they didn't even know they had before, once they're challenged and their brain isn't working the same way it used to.
I've been doing desk jobs and I've been a singer, so I tried to go back to those things, but it just wasn't working. It was kind of like a birth. Lots of crying and angst about why I couldn't do the jobs I could do before. And so a wonderful vocational counselor said, well, why don't they take a personality test and then we'll, and I had always answered those things the way I thought I should when I was in college, but I answered it truthfully after I was done mostly rehabbing from the stroke. As I began taking classes, I first took a figure drawing class at a community college, and the teacher was so accepting and nurturing, and it was so fun to put my arms and hands up to the paper and make some marks. And now I find that I need to do it on a daily basis. I'm opening up a studio in Georgetown in September, and I'm so excited because I've been without a studio for a year, and I've been working small, but I like to work big. This piece is called Anticipation. It's a mixed media piece, but it's mostly referencing a big 24-hour clock that I had to watch when I couldn't do anything but blink in the ICU. I stared at that all day, and I was inside there totally fine, just I couldn't communicate or move in any way. So worked my way into being an artist, and it's truly me. I'm so excited. Like, in a way, the stroke was a catalyst for me becoming who I am. I might have been this person later, but it would have taken me maybe 30 or 40 years to get there.
I've known some of these artists since they were in a coma, and we're unable to move, we're unable to walk, we're unable to talk. So it's eternally surprising to see the depths that people can draw into themselves and pull out and be so creative. And you think, oh, serious brain injury, they can't, people can't do anything. And that's not true. There's life after brain injury, and I think this is such a demonstration of that.
One night to be confused, one night to speed up truth. We had a promise made, 4 hands and then away. Both under influence, we had divine sense. our hands are above to lean on. Would it be good enough for me now? One night of magic rush, the start a simple touch.